Urinary system. Frequently asked all types of questions answer mixed solution. These questions are enough on urinary system. 1. Define urinary system. Urinary system is one of the most important and chief excretory system of the body, which helps infiltration of blood, formation and excretion of urine. 2. Name the organs of urinary system. Urinary system is chief excretory system of our body. The organs of urinary system are 1. Kidneys 2. Ureters 2. 3. Urinary bladder 1. 4. Urethra 1. 3. Describe the structure of kidney. The kidneys are 2 in number, described as bean-shaped organs, situated against the posterior abdominal wall, behind the peritoneum retroperitoneal, 1 on each side of vertebral column. It is 11 centimeters long, 6 centimeters wide and 3 centimeters thick with 150 grams weight. The kidney consists of countless microscopic structures called nephron and collecting tubules, which together are called uriniferous tubules of connective tissues like blood vessels, nerves and lymph vessels. The kidney is composed of 3 main structures: 1. Renal corpuscles, renal tubules, renal arteries, veins and supporting tissues. The kidney can be divided into external and internal structure. External structures: renal capsule, hilum. Internal structure: cortex, medulla, renal pelvis. 4. Write down the functions of kidney. Kidney is the vital organ of excretory system. The functions of kidney are 1. Formation and secretion of urine. 2. Filter blood plasma, eliminate wastes. 3. Regulate blood volume, blood pressure. 4. Regulate fluid osmolarity. 5. Secrete renin. 6. Secrete erythropoietin, EPO. 7. Regulate PCO2, acid-base balance. 8. Synthesize calcitriol, vitamin D. 9. Detoxify free radicals, drugs. 5. Define nephron. Nephron is the structural and functional unit of kidney. 6. List the different parts of nephron. Nephron is the functional unit of kidney. The different parts of nephron are I. Glomerulus. E. Bowman's capsules. E. Tubules. Proximal convoluted tubules, PCT. Descending limb of loop, DLL. Loop of Henle, low. Ascending limb of limb, all. Distal convoluted tubules, DCT. IV. Conducting tubules or ducts. 7. Draw a well-labeled diagram of urinary system. Fig. Urinary system. 8. Write down the functions of different parts of nephron. Different parts of nephron have their own functions. The functions of different parts of nephron are glomerulus, filtration of water and all solutes except colloids like plasma proteins. Proximal convoluted tubule and loop of Henle, reabsorption of sodium, potassium and some other ions, glucose, amino acids, etc. by active transport and osmosis. Distal convoluted tubule, reabsorption of other ions, water and some other drugs by active transport, osmosis, secretion. Collecting tubules, reabsorption of water by osmosis. 9. Define GFR. GFR is the rate of fluid transfer from capillaries into Bowman's capsule. 10. List the factors affecting GFR. The factors affecting GFR are increased blood volume, increased blood pressure, the pressure difference in the glomerulus, secretion of renin, constriction in the afferent arterioles going to Bowman's capsule, hydrostatic pressure in the Bowman's capsule. 11. Describe the mechanism of urine formation. Urine formation takes place by following mechanisms. A. Simple filtration or formation of GF. Filtration occurs through the semi-permeable due to pressure membrane due to pressure difference in glomerular capillary and Bowman's capsule. Glomerular hydrostatic pressure equals 60 mm of Hg. Colloidal osmotic plus hydrostatic pressure in Bowman's equals 50 mm of mercury. Water and small molecules are the major constituents. B. Tubular reabsorption. Tubular reabsorption is the movement of substance from filtrate in the kidney tubules into the blood and peritubular capillaries. About 99% of glomerular filtrate along with Na+, Cl, K+, H+, HCO3, glucose and amino acids is reabsorbed back into blood from different parts of tubules. C. Tubular secretion. Transport of substance into the filtrate is called tubular secretion. Substance those transported to filtrate are H+, K+, NH3+, urea, creatinine and some drugs. Finally, urine is formed in collecting ducts which then reaches the minor calyxes into major calyxes. From major calyxes urine goes to renal pelvis and finally carried to urinary bladder through ureters. 12. Define micturition. Micturition or urination is the process of expelling out of urine from urinary bladder when it becomes filled. 13. Describe the process of micturition. The process of micturition are: normally when the bladder contains 200 to 300 ml of urine, the stretch receptors in wall of bladder are stimulated. There is initiation of micturition due to involuntary autonomic response. Impulses are transmitted to the wall of urinary bladder. Causes contraction of bladder wall. Increases pressure in the bladder. Thus, the process of micturition occurs by relaxation of voluntary sphincter. 14. Write down the composition of urine. Urine is composed of water 96%, urea 2%, uric acid, creatinine, ammonia, sodium, chlorides.